actually am a myositis patient. But today, I would like to introduce Dr. Lee Phillips, who is in private practice in Arlington, Virginia, where he treats chronic illness and sexual dysfunction. He's a licensed clinical social worker in DC, Washington, and Virginia, also certified sex therapist by the American Society of Sexuality Educators, Counselors, and Therapists. Dr. Phillips has been in private practice for more than a decade, working with couples on sexuality after chronic illness. Dr. Phillips, we're excited to hear your presentation.
Thank you. I'm happy to be here.
Lee Phillips, and I am a certified sex therapist and a licensed psychotherapist, and I'm thrilled to be with the Myositis Association for the conference this year. And in this talk, it is remaining close to your partner. So I'm going to be giving you some tools on how you can remain close to your partner, how you can get emotionally connected to each other despite having a diagnosis of a chronic illness. And that's going to be the whole point of this talk. So this session, it will explore how those living with chronic illness and their care partners cope with changing roles and their relationships, how to carve out time to their partner's emotional, social, and relationship-based needs, and how to be present for each other. And I can't say that enough. This is going to be a presentation about how to be present. So for our objectives, we are going to first talk about understanding the grief process in chronic illness. That is critical when it comes to this because there is a grief process that has to happen usually first to remain close to your partner, and partners can do this together. And so I do want to talk about that. And then we're going to talk about caregiving and techniques to enhance your communication with each other. And again, so you can be present. And that is the big goal here at this talk. So let's get started. So for the first, a lot of times when there is an onset of a chronic illness, we see denial. And during this stage, the individual or the couple may experience denial about loss they are going to experience or they are experiencing by losing what happened as a healthy individual and now merging into having a chronic illness. Partners and other loved ones may be very conflicted at this stage. What do you mean this is happening to us? We never thought this would happen to us. And so a lot of times when there's this denial factor that comes in, it can be with both partners or just one. And this can create some rupture in the partnership that we may find. The second one is anger. Of course, there's going to be anger that comes. And the anger begins to grow because of illness. Partners and other loved ones, they may become the target of their anger. So sometimes we may see some scapegoating, or we may see a little bit of projection that comes. Jealousy may also rise out at this stage. I've had couples come in where the ill partner is very jealous of their healthy partner. You know, your medical needs are met. You're fine. You don't have this. You don't know what it's like to go through this on a daily basis. And so my goal as a psychotherapist is to really help them become connected so there can be more empathy that's engaged there. The next phase is bargaining. This happens where, this usually happens in the early phases of a chronic illness where people, they try to keep their illness at bay and they bargain with their higher power that they will do anything to be healthy again. And a lot of times, this is where I will see an individual or I may see a couple come in to therapy. They're wanting to find out what they can do because they're really on this fence. They've got one foot over the fence where they're wanting to accept, but they can't yet. There still may be a denial factor there. There's still anger going on as well. So after bargaining, we do see depression. Depression is the most common mental health problem that comes with being chronically ill. Whatever the depression is focused on, it's real, and it's usually predominantly about loss of a healthy body. And that is a grief process that has to happen. Now, keep in mind that grieving is not linear, so you really don't go from sometimes denial, anger, bargaining. You may oscillate in between stages. That's very common. And so my goal is to really meet my clients where they're at when that happens. The next phase is acceptance. This is critical. It's very powerful when someone can get to acceptance. A lot of times when we're going through the grief process of a chronic illness, we will find that during the denial phase, there is a sense of avoidance. Now, with avoidance, it only helps us temporarily, right? We push it off to the side, but guess what? The illness is still there, and it's going to be there. And so the goal is to really work through these stages and get the help that you need so you can get to a place of acceptance, because when you can get to acceptance, that's going to help remaining close to your partner. That's where your partner may be your caregiver, but they're also your partner. And so that's critical as we talk about this. Let's talk a little bit about the effects of illness on the relationship. The change in roles. This is big. So prior to becoming ill, you may have been the person that always did things, right? You cleaned the house, you cared for the children, you cooked the meals, you did the errands. It was your role. You know, we all have roles in relationships. Sometimes we switch roles. But the changes in roles may be depending on the course of the illness in some cases, and they may be permanent, right? So when you get to a place of acceptance, you may be able to integrate some of those things in your past into the present. But we do see a change in roles. Let's talk about gender. You may be a man in the partnership, right? The husband, very masculine, the provider for your family. You're the one that did all the work, the breadwinner of your family, and all of a sudden, there's been a diagnosis of a chronic illness like myositis, and you don't have the energy level. There's a lot of muscle weakness, and you find out you can't work anymore, right? So there's a change that happens, and that is a big grief process that really does occur. Independent to dependent, right? We have this independency. We all grow up, usually, to become independent, to care for ourselves, to care for our families. And couples who behaved independently from one another now may become interdependent, both because they care and the emotional demands on coping with the illness. So you become dependent, right? But a lot of times, this is not always bad. You can find pleasure in this. It's a way to be there for your partner. That sometimes gets pushed off to the side, and that's where sometimes when I'm working with a couple, I can really help them get into a place of acceptance where it's okay if I have to be dependent on you, I'm dependent, but maybe I can integrate some independency in my life. Caregiving stress. The couple's quality of life, it may change due to physical demands imposed by illness, but also because of the financial and social changes that also happen. This is a big part of it. There's a caregiving stress that occurs. We see caregiver burnout when the burden is so great that its negative impact on caregiver and recipient outweighs the benefit, right? So there's not much of the positivity of things coming out of it, but there's more negativity that happens. My recommendation is always to find a caregiving support group. I think they're amazing. Or an online support group that can be very helpful. Caregivers of those with chronic illness often encounter multiple co-occurring stressors that can happen due to their partner's fluctuating health status, stressors that manifest as demands over time. But what we have to really keep in mind is that caregiving may also be emotionally rewarding. It can also be a way to strengthen your relationship. But what it comes down to is that you have to talk about it. You have to communicate those needs that you have because it can be quite rewarding. And I've seen this happen. And my goal is to really help couples get there. So when it comes to healing the relationship, when I think of remaining close to your partner, I think of the word healing. When I think of treating a chronic illness, I think of healing. When I think of intimacy, I think of the word healing. So in this case, there is a type of relationship therapy that I use with my couples, and it's called Imago relationship therapy. Imago is Latin for image and also reflects the mature stage of a butterfly. Imago relationship is based on the theory that the frustrations, conflicts, or feelings experienced during childhood often manifest themselves in our adult relationships. when we seek a partner who is the image of our childhood caretaker. That can sound very confusing, but basically what this means is that when we grow up, we develop all types of images in our mind on what life should be like. Those images come to us by the messages that we get from our caretakers. They can be from our teachers, from our peers. And so in our unconscious brain, we unconsciously pick a partner based on the positive and negative characteristics of our caretakers. So for an example, you may hear someone say, oh my gosh, he's just like my father, or oh my gosh, she behaves just like my mother. That is what this comes from. The way that you were raised brings up those images, and so you pick a partner based on those characteristics. So you may want a partner who's nothing like your parents, and then you may unconsciously pick a partner that's a lot like your parents. So this partner choice reflects a longing to integrate a part of ourselves wounded in childhood. All of our needs are supposed to be met in childhood, but they're not met. You know, when people come to me and they say, you know, my childhood was pretty stable, usually that means it was enmeshed. So what we find is there's either an enmeshment that can happen or there is an avoidant that can happen. And this happens with attachments. Say, for an example, that you're raised in a family where your caretakers were avoidant, they were cold, they weren't necessarily there for you as a child. So when you grow up, you may develop an anxious attachment where you take those needs that you didn't get and you latch onto your partner because you didn't get it in childhood, or you grew up in a home that was full of enmeshment, and what happens is you're attached to your parents' hip, right? You got to stay in the front yard. You don't cross the street. You don't go play with your friends. You just stay right here where I can see you. You may get smothered. So when you grow up, you may actually become avoidant to your partner because you were so smothered as a child. I see this happen all the time. Avoiders, a lot of times, and attachment folks, anxious attachment folks really come together a lot. So there is no coincidence that we choose partners as we do so based on their similarities or differences of our parents. That's really what happens here. And I have been trained in several different types of relationship therapy, everything from emotion-focused therapy to the Gottman style, and I find Imago relationship therapy the best for me because I find that it really does help my clients. So even in the best childhoods, people don't always get their needs met, right? I just mentioned that. You know, you can come from a great family, stable family, needs are met in your way, but I'm sure there is something that was not met. And that does not mean it's necessarily your parents' fault. They were raising you maybe the best way that they could. Maybe you had a sibling that got all the attention and you kind of took the back burner. That can happen too. Although this enables individuals to grow up and take care of themselves as independent functioning adults, it can also mean they may seek another person who will fulfill those unmet needs when they grow up, right? So since those needs weren't met, you're going to grow up and find a partner who can fulfill those. In the initial romantic stage of a relationship and prior to illness, those unmet needs are met as each partner feels safe, connected, and relaxed. But when an illness strikes, this can really shake things up. And I see this every day in my office. When the illness strikes or they're no longer fulfill each other's needs emotionally or sexually, one or both partner may become critical or shaming. They can withdraw or they can attack, right? So there's two coping adaptations that people usually have when it comes to Imago theory. That is a maximizer, where they are the energy out person, where they put all their energy out and they lash out, they scream, they yell, they want to solve the problem right away. Why aren't you paying attention to me? We need to work on this right now. Their partner may be the opposite. We call them the minimizer. So what happens is they may shut down, stonewall, they withdraw, they go into their shell. So we call the maximizer the hailstorm or the tiger because they go in, and we call the minimizer the turtle because they go into their shell. But if you poke that turtle long enough, they'll turn into a snapping turtle. And this is where we start to see a power struggle. I want to talk a little bit about shame. Shame is one of those emotions that is so consuming, and it always comes with a chronic illness, 9 times out of 10. There is a difference between guilt and shame. So people that are chronically ill, they experience guilt, so does the healthy partner, and shame. So for an example, guilt is I did something bad. Shame is I am bad. It's like you internalize it. It literally goes from your head to your toe. And it's one of those emotions that's really hard to shake off. But one way to deal with shame is to talk about it. When you work through it and you have a safe container, like in your therapist's office, you're able to really share that. So once we leave the unconscious part, we go into the conscious part. And so this is where we have to really stop getting reactive and we get proactive. So the whole goal of relationship therapy to help remain close to your partner is to get less reactive and to be present. And so there's something that I use called the Imago dialogue. So in Imago relationship therapy, I help couples work through this dynamic in order to heal each other from their childhood wounds and create a healthy relationship they desire by facilitating a dialogue. And it's characterized by active listening, which is through mirroring, validation, empathy, and behavior and change request. The couples, they really learn how to be both connected and differentiated. The whole goal is to talk about how you connect, how you can remain close. But one of the things that couples don't do enough of is talk about their differences. They feel like they always have to be on the same page. I have to be right or you have to be right. It doesn't matter who's right or wrong. It's about a connection that you need to have. And you need to talk about your differences. It's okay that you're different. It's what makes you a strong partnership. And so from one session to the next, a new positive imprint is created. And gradually the couple can move from the power struggle to a joint journey of understanding and connection. That is the whole goal. It's for them to get really connected with each other. So in the dialogue, I use it because it's a structured technique and it keeps couples to communicate around the difficulties due to chronic illness, right? So it creates an atmosphere, or I call it a safe container, to be less reactive. This dialogue, it starts with one person being the sender, sharing thoughts and feelings, while the other partner is the receiver, where they listen, validate, empathize, and then the partners switch roles. Sometimes we may not switch roles in the session because we've had a very long dialogue and we've covered a lot. And so we may not have time to do that. But if there is time in the session, we will do that. Through mirroring, validating, and empathizing, this structured active listening process, it's a way to deal with conflict in a relationship while letting both partners feel heard. So again, it's having that safe container, because think about this. When you're talking to your partner, 9 times out of 10, you're probably not fully listening. I think that's hard for all of us to do. And as your partner is talking to you, you may be thinking about how you're going to be reactive. You're already thinking about what you're going to say because they're coming at you. This process, it doesn't allow you to do that. To practice the technique, I have each partner share their thoughts and feelings on an agreed upon topic. It doesn't have to be anything negative. It can be about where they're at with the illness. You know, where are they at in the grief process? Are they in denial? Is one partner still in denial? Are they in acceptance? And what is it around? Is it around intimacy? You know, is it around because they have not been sexual in so long because of the illness? All of that has to take place. It's best to start with something easy and not too triggering. So the reason why, first of all, it's important to start with something easy, because your partner has to mirror what you say. If you go into this dialogue and you say something so drawn out, they may not get all of it, right? They have to listen to what you're saying. So you want to start off with something simple. One of the things that I usually start off is with appreciations. What have you appreciated about each other since I've seen you last, or in the last couple of weeks? When you start off with an appreciation and you mirror that, that really sets the tone for the session, and it can also get a theme going. It's also important to talk about the strengths. You know, couples come into therapy because there's a rupture, there's conflict, right? And with my clients that have experienced chronic illness, they're really coming in because of what the illness has done to their relationship, whether it's about their communication or sexuality. And so we want to start off with something that they can really process and they can come to an understanding of. It doesn't mean that one's going to be right and one's going to be wrong, but they need to have some type of common ground. So the couple chooses who will be the sender, who's going to be the receiver. The sender begins by saying one thing that they feel to be chosen on the chosen topic, and then the receiver mirrors back what they hear. Mirroring is simply listening to in an active way without inserting one's opinion. So you're not shaming them, you're not putting them down, you're just sharing. It involves responding by repeating what was heard and sending the informant back. So you're sending something and they're going to send it right back. I lead the couple through the process by keeping the container of the dialogue safe and allowing the couple to enough structure so that they can relax relax back and forth a conversation, encouraging them to go deeper than what they usually do, right? So whenever the sender shares their feelings and the receiver mirrors back what was said, I encourage the receiver to ask, is there more? And I'm going to show you a template that you can use. This is a way to let the sender know whatever was said, it was welcomed and it was heard. And so the receivers continues to mirror back and they say, is there more? The receiver is then encouraged to validate what the sender has said. It makes sense knowing the way that I know you, that you're feeling this way, and then you would put an emotion on that. Next, the receiver exhibits empathy by showing some feeling words to help them understand what the sender is saying. So for an example, that may say, I imagine you feel this way. Here's the thing with validating. I will have couples come in and they will say, Dr. Lee, why do I have to validate my partner when I don't agree with them? You have to remember that validating is not agreeing with your partner. It's just acknowledging their feeling on what they're feeling at that place and at that time. In doing so, the receiver tries to express their understanding of what their partner might be going through, even if they don't agree, right? And the goal is not to agree, but simply to be heard and to find empathy. Okay? And then after you do that, you would switch roles, and whoever the sender is going to be, they will bring up a topic. It's a great way to feel heard. It's a great way to feel present, and it really does create the intimacy that you need and to remain close to each other when roles have changed in your life due to a chronic illness, right? And you may be able to talk about what you miss and how you can reminisce. I found that can really help couples. So I'm going to go over the communication tool with you. This is something easy that you can use at home. A lot of times I find that couples need to practice with me in the office for quite a bit of time before they do this at home, because they will often say when I first give them this, they struggle with it at home. So a lot of times I have them do the dialogue in session with me for a lot of reasons. One reason is they may not be ready to do it at home because there's a lot of conflict. So the sender would say, one thing I would like to say about this topic is, and you want to keep it brief and short. The receiver, so one thing you would like to say about this topic is you're simply repeat what they say. And then after you say it, you will say, is there more? And the sender will say, yes, and they will go on. And then the receiver will say, is there more? And then the sender will say, no, that's good for now. You got me. The receiver then goes on to validate, right? That's that second stage, validating. Knowing you the way I know you, it makes sense you would feel that because, and then they would say, did I get that? Or if they don't understand, they could simply say, it does not make sense. Tell me more about that. And then the sender would say, yes, you got it. The receiver would then go on to express empathy. I imagine you must feel, right? Are there other things that you feel? And then the sender would keep going, and then you would mirror back. The sender would say, you got it, I also feel, and then you would keep going and mirroring. So if you think about it, you're mirroring through the entire dialogue process. And then the receiver would say, thank you for sharing this with me. It's a great tool. It really does work. I find it's a great way to bridge your communication when there's been disconnection in your partnership. I find it is a great tool to use when you are grieving. And I think it's something that all of you would really benefit from. So now we're going to take some questions at this time. for the remaining close to your partner presentation. And you can always find me on my website at drleephillips.com. You can always email me with any questions that you have, drleephillips@gmail. And then you can follow me on social media at Dr. Phillips on Facebook and Dr. Phillips on Instagram. And then I'm also on Twitter. It was great being with all of you, and I hope you found this to be extremely helpful. Thank you.
Great. Dr. Phillips, thank you. So for the questions, unfortunately, we have to have the participants type the questions into either the group chat or the Q&A questions. Okay. So can you see the Q&A? And I'm not sure we have any questions. So let's start.
Yeah, we have some right here. I hope, Jerome, you were able to finally hear everything. If you've got a therapist already, but they're not really equipped to deal with chronic illness with intimacy connection, is there a way to find someone local to us who has experience in this area? So, Julina, wherever you are at, one of the things that you can do is go to psychologytoday.com, and you can put in the search engine therapist that treats chronic illness or sex therapist that treats chronic illness, and you can find someone in your area. I'm in the DMV area, so I'm not sure where you're at, but that's one way to really be able to find someone. Let's see, would Imago Dialogue be available in printable format? If you would like, Janet, to email me, I can send you the dialogue so you can have it. Just shoot me an email at drleephillips@gmail, and I can go ahead and get you that template that I have in the slide there so you have it to practice at home. Absolutely. Let's see if we have any other questions. Any other questions about Imago? I had to tell you, I use that every day in my practice with couples, and they absolutely love it. Do you treat patients via telehealth for those of us who live in rural areas? I do. I will tell you, I'm at a group practice right now, and so I'm very full, but I'm opening my own practice March 2021, which I'm really excited about, and I will be starting off doing telehealth. I'm not going to have an office due to COVID right away, and I don't think I may never need an office again. It depends on what rural area that you're in. We're supposed to be licensed in the state where the client is living. The boards of social work and counseling and psychology are getting a little strict on that. There's been a little bit of flexibility due to COVID, but if you would like to go to my website and send me a message, you certainly can. There's a little message part on drleephillips.com where you can send me a message, and I'll definitely get that and I'll get back to you. I know one thing that I have tried to talk about is I feel like a burden, but my spouse keeps saying she does not know how to tend to me in the future. I try to tell her it makes me feel worse. How to handle this? Well, Randy, I would recommend that you try to use the dialogue, because when you use the dialogue, your partner has to mirror you, and they really connect with what you're saying. It sounds like when you send the message, there's some reactivity that goes on there. So if you get the dialogue, you can sit down with each other and you can use that. That helps with reactivity. And a lot of times my clients will come in and they will say, I feel like a burden, and my spouse tells me you're not a burden. And sometimes that can stir up a lot of feelings. I know it can make people feel worse, but how to tend to you in the future, that's the scary part, I think, sometimes of an illness, right? It's very unpredictable. So you don't know what's going to happen one day from the next. So one thing that I really try to work on with my couples is to stay in the present moment. A lot of people go into what I call the what if factor. So what if this, what if that, what if this happens, what if that's going to happen? Well, change the what if to what is, what's happening in the moment, right? And there's a lot of opportunity that can go on in the present. You know, we tend to project into the future. Why? Because our illness and our relationships, it causes anxiety. And when we get anxious, we think about the future. So that would be my recommendation for that. The dialogue can be very helpful. But also, if you're not going to do the dialogue, I mean, one thing that I recommend to couples too is what I call, and if you attended my session yesterday, I talked a little bit about this, is I recommend that couples have a check-in with each other. And I would schedule that check-in once or twice a week where you actually sit down and you talk about whatever it is that's on your mind. Talk about the strengths that's in your relationship. Talk about the things that you miss, that you may want to try to connect again. When you have a chronic illness, I think it's important to try to integrate as much as you can into your life that you had prior to your illness. And I think a lot of times acceptance comes with that. And so then talk about your emotional needs. Is there something that you need from each other? That can be emotional needs. That may also be sexual intimacy needs. And then talk about what your differences are, the way you see things, and see if you can come to an understanding. And you don't have to get so reactive. If you're not going to use the dialogue, that's one thing that you can do, but you can also use the dialogue and do that 3-step process where your strengths, your needs, and your differences. And I think that can be very helpful. Any other questions? Okay, I'm in a 2-year relationship with a man who has IBM for about 9 years. Based on your talk, I think he has moved through the stages well before me. I am still struggling with committing to a long-term relationship, which will cause losses for me and expectations. I feel I am still grieving and bargaining. Any advice? Okay, one thing that I would recommend is that you continue to go through your own process with grieving and talk to your partner about that still. I find sometimes there will be 2 people that are both chronically ill that are in a relationship, and they may be at their different stages with each other, and that's okay. The one thing that you have to understand about grief is that it's not linear, so you don't go from one stage to the next. You may go from anger to acceptance, and then you may go back to a prior stage. It depends on what's going on with you in that moment. So one of the things that I would do, again, you could use the dialogue and just talk about where you're at and how you're struggling and you're committing to a relationship. I think one of the things is to really be honest. I think that's going to be very helpful for you. One of the things that I talk about with my couples or with anybody, that if I have an individual client that's in a relationship, is you need the big 4: trust, honesty, communication, and respect. And if those 4 can be met, you're really off to a good start. So one thing that I would do is just kind of talk to your partner where you're at in your grief process. Great question. And I know that can be very difficult. Absolutely. Grieving the loss of the lover relationship as I become more of a caregiver. Tips. Excellent question. That's actually a really good question. So first of all, I would allow yourself to grieve, because grieving is important, because grieving leads to acceptance. And then I would really have a conversation on what are the benefits of being a caregiver and what are the things that you miss about being a lover. What relationships work when you communicate. And I think sometimes when we're going through loss and we're going through hurt, we tend to clam up, we don't talk. And we also think our partner should know what we want, but our partner doesn't. So grieve that loss of a lover, but you could also become that lover again in different ways. And I talked a little bit about that yesterday in the intimacy training or session. And so that would be my tip, is to talk about why you are feeling the loss and how you can reclaim being a lover. And I would recommend definitely seeing a therapist about that if you're not able to do that on your own. You know, having a safe container is a good way to be able to process that. That's an excellent question. Thank you for asking that. And also, being a lover, what does that mean to you personally, right? If you're going to be a lover to someone, how are you a lover to yourself, and how do you love? And that's really important when you're going into relationships. And it doesn't matter how long you've been with each other. It's a great thing to think about. These are great questions. Thank you so much. Do we have any other questions? You know, caregiving, it can be very special. It's a way to enhance intimacy, and I think sometimes we focus on the stress of it, but sometimes we have to focus on the benefits too, and how it can lead someone in becoming more intimate with each other as well. That's one of the things that I talk about in my work as a therapist, are the strengths. What's going on that's great in the relationship? You know, we know that a problem, usually, you know, people come in with a problem, but, you know, what are the good things that are going on? We have to think about those too. Let's see. Any other questions about Imago, or if you would like a copy of the dialogue, please just shoot me an email and I will get it right to you. I do know that trying to focus on what she has done with positive feedback. Positive feedback is important. You know, I think there's a way to share your needs, and you do it in an empathetic way. It's all about the way we send a message too. If you send a message, you know, your partner may receive it a different way. And I think it's important to talk about that. Share how you felt about it. Have a dialogue about it. You know, one of the things that happens is there will be a rupture or a power struggle, and then it gets kind of tucked under the rug. And then it's like you go back to what was going on prior to that, but then that problem, it's still sitting there. So the antidote is to really bring it up again and talk about it and get your feelings out. You know, what's interesting is that I've noticed that when couples come in and they actually talk about this, their chronic pain symptoms have decreased, or they've actually been able to manage them better. I think when we hold a lot of our energy in, it really affects our pain. You know, if you're feeling, what we have is something called, I call it the PSPR effect. And I'm going to be talking about this in my book, Sex and Love When You're Sick, where you have a physical symptom that triggers a psychological response. So if you're feeling ill, what can that cause? Anxiety and depression, right? But guess what? If you're having a psychological symptom like anxiety and depression, it can actually trigger your physical pain too. So it's like a ping pong effect that's going on. And I think that when you're able to manage your depression and anxiety and stressors in your relationship, you know, we're able to manage our chronic pain symptoms a lot better. And I noticed that I actually have a diagnosis of Lyme's disease. And I noticed that with my Lyme, that I was able to manage my symptoms better when I was feeling less anxious. So that can be helpful too. Okay, here we go. I sometimes crave less intimate forms of connection, but my partner doesn't seem to think it counts because he knows I enjoy the more intimate connection as well. I sometimes crave less intimate forms of connection with my partner. So one thing that I would do is talk about what intimate connections mean to you and what do they mean to your partner, right? Talk about your differences with it and talk about what it is that you want in terms of your intimate connection. You know, intimacy is such a broad word. It means several things. Sexual intimacy is only one form of intimacy, right? Intimacy can be hand-holding. It can be sitting on the couch watching a movie together, the way you look at each other, laughing together. There's a lot of ways to count intimacy. So I would kind of just talk about what is your meaning of it. And that can be the second part of a dialogue. What is your need, right? How do you get partner to express their needs? Great question. Well, you want to talk about it. You know, it's interesting. Communication is one of the easiest things to do. It's also very hard, right? The reason why it's easy is because it's easy to sit down and talk. It's hard because you're afraid of how your partner is going to take what you're saying. So one way to express needs, Alice, would be to use the dialogue, because you're gonna send a message, or your partner's gonna send a message, and you're gonna mirror that back, and then you're gonna validate what their needs are, right? Needs are very broad too. We have emotional needs, we have sexual and erotic needs, we have a lot of needs, and I think sometimes when couples can talk about those needs, you're going to find that it's really going to help your relationship, because sometimes if you don't express your needs, your partner's not going to know. I have several couples that come in and they always say, you know, I think my partner should know how I feel. But that doesn't always work. Your partner doesn't know, you know? So if you can express it, you know, and just say, hey, you know, I would love for you to tell me how you're feeling right now, you know? And I think that goes far. And sometimes it's very hard for a couple to do it on their own. So I think that's very helpful when you can go see a couples therapist, so you can have a safe room to be able to talk about it. From your experiences, are there some common concerns we can anticipate and work to avoid so we don't have a great negative impact? I really don't like the word avoid. I feel like avoid, it works temporarily, and then the problem is still sitting there. I think you should talk about whatever comes up for you. Even if there is a little bit of negativity in the beginning. You know, a lot of people, you know, we don't like negativity, but sometimes we have to experience some difficult conversations before things can get better. So you may want to not avoid and work through those things that you're really not trying to talk about, because it's like the big fat pink elephant sitting in the living room. It's still there. And sometimes if you talk about it, there may be some negative impact in the beginning, but that can always lead to something positive as well. So I would consider that. I would really watch avoidance. The opposite of avoidance is acceptance. It's accepting what's happened in the moment and being able to have a conversation or a dialogue about it. So I would actually encourage you not to avoid anything that comes up for you. Go ahead and share that. That may be very helpful. How to deal with a long distance relationship over the winter when the illness separates us. Wow, that's very difficult. I would continue to be in some type of constant communication. I think long distance relationships can work when you really put in the work. So I would recommend having some type of schedule with each other where you Zoom. You know, I think a lot of us are doing that these days due to COVID, right? Zooming with each other, FaceTiming, have like a topic that you want to talk about when you Zoom with each other. I know illness can be very difficult because you may not feel like talking, but I would encourage you to have a set schedule for yourself. You know, I've worked with a lot of clients where they do have another partner in a different state. And you know, they come in and they talk about that stress and what that does to them. But I think the more if you have a system with each other, you can definitely make it work. These are excellent questions. How long is too long to be estranged from each other due to the ups and downs? Well, you have to watch being estranged, right? If you spend too much time away from each other and you're not talking about things, the one thing that I always tell my couples that they don't want to get to is resentment. When you get to resentment, it's really hard to turn that around. So if you're feeling like it's becoming too estranged, you really want to do something about that in the beginning. You want to start talking about it now. Have I seen resentment be able to be turned around? Yes, but it's very difficult. So being estranged is very hard. I don't think there's really any due time with estrangement. How long is too long? Well, that's going to be up to the couple, but I would really start talking about things immediately, because you can see a positive outcome come out of it. It's a great question. If you lack self-confidence, how do you avoid feeling that you will be judged? It's a great question. A lot of times when we lack self-confidence, we definitely start to go into avoidance mode because we don't feel like the work that we're going to do is going to help us. I would really work on the self-confidence first. And the one thing that I think we have to do is that, you know, when there is confidence and there's a form of self-esteem that's there, you don't really worry about what people think about you all the time, because you are your own individual and you have your own uniques and your own strengths. So if you're lacking self-confidence, I would highly recommend getting a therapist. A therapist can really help you because the therapist is going to help you identify your strengths. And I would urge you to do that to work on your self-confidence. And a lot of times when people are diagnosed with an illness, the confidence it can go to the wayside. Absolutely, right? Because when we have a chronic illness, a lot of the changes can be physical, right? And they can also be psychological. And those two factors can really affect our self-esteem. So you want to be able to work on both of those. And by talking to someone can really help. Anytime we have some type of self-esteem issue or a confidence problem, you can really get the help by at least having a safe place to talk about it and really honing into what are your strengths. I am a strengths-based therapist. I find that when I focus on strengths, it really helps. So I would urge you to get a therapist. If you have a therapist, start working on that. Start working on what are those great things that are going on so you don't have to avoid things. Remember, I don't like that word avoidance, but we all do it sometimes, right? But I think we do it because it serves as a purpose temporarily. So you want to be able to talk about that. Another excellent question. Great. Any other questions? Thank you. I'm glad this was very helpful to you, and it was a helpful presentation with some important, meaningful points. Great. You're welcome. Thank you. I really love this work, and I think it can really help when you can come into a safe place and be able to talk about your feelings as it relates to your illness. Any other questions? Please don't let this be the only year you present. I would love to come back. And you can always follow me on Instagram or Facebook if you would like. If you go to my website, I have blogs on there. I write, I publish a blog at least once a month. I try to do more if I can. And I have a lot of blogs on there relating to chronic illness and sexuality. So please feel free to go onto my website, drleephillips.com. You can look at my blogs. If you have a question, please reach out. I would love to hear from you. I enjoy helping as much as I can too. So.
Dr. Phillips, this is great. This is absolutely fantastic. Are there any highlights or any things from the questions or your presentation that you would like to reiterate to all of us?
Yes, that's great. One of the things that I would really suggest is that what's very helpful with your partner is to really set aside some time where you have something, what I always call the partner check-in. It's very helpful where you come to each other and you have a topic that you want to talk about as it relates to communication. And again, that would be talking about your strengths in your partnership, what are the needs that you have, and also what are your differences that you're seeing and how you can accommodate each other. I think if you don't do that, a lot of times couples tend to get into a power struggle. And so I would really, that's the one thing that I want you to get out of this, is to make sure that you are talking about the specific needs that you have. I know a lot of times it's hard to do that because of feeling like a burden, or you just don't feel well, right? But those moments that you do feel well, that would be the time to really check in. So that's the one thing that I would really hope that you can take from this.
So we still have time for more questions, if anyone else has any.
Let's see, there will be a whole new batch of New myositis patients diagnosed between now and next conference, so we'll need to hear from you. Great. Well, I would love to come back and talk more on this topic and maybe add some more things to the topic. We can definitely do that. Let's see. What if I want to have us see a sex therapist, but I don't think she will agree? Okay. Well, what I'm kind of hearing from you is that you don't think she will agree, so you don't have proof that she won't. So one thing that I would do is talk about it, voice your concern, say our partnership, see, it's almost like a buy-in kind of, but you're doing it for both of you, right? So, hey, I really care about our partnership and where we're at. And I really want us to talk to someone about what's happening with us sexually. I think it could help us. And I know it would be important to me. So you may just want to approach it that way. And of course, from an empathy, right? All from empathy. So I would definitely focus on that when you're having a conversation about it. And here's the thing. If she does not want to go, you can go. I think that can be very powerful. I see plenty of people that come to me and say, my partner didn't want to come, but I wanted to be here. And so, you could go see someone for yourself. That could be helpful. Have you considered writing a column in the TMA newsletter? This is excellent, or maybe a Dear Abby format. No, Jim, but I would love to. I would be more than willing to write in the newsletter, to contribute as much as I can. Would love to. I love writing. I like getting the word out there. I also wanted to mention that I am starting my podcast with a network called Invisible Not Broken. So if you go to invisiblenotbroken.com, I am starting my podcast. It will be starting at the end of this month, which is called Sex and Chronic Illness with Dr. Lee. So I'm going to be having experts on the podcast, but also folks that have chronic illness to share their story. And I'm really hoping that I can get some couples on the podcast. I think this is going to be excellent. It's a group of us in the network, and we each have our own podcast. So please look out for that. If you follow me on social media, then you'll definitely see the announcements as time gets closer. I think the first episode is going to air at the end of September. That way, we've got stories that we're sharing from real individuals and couples that are reclaiming their sexuality or their relationship with chronic illness. And then, of course, I'll have some other therapists on there that also work with folks that have chronic illness and other disabilities. Let's see.
I'm just looking. It's tough with a podcast. I said it's difficult with a podcast. I hope you get a couple of really good people.
Yeah, I've already got some people that are very interested in coming on. Some other sex therapists, relationship therapists, but also, folks that have reached out to me that are willing to share their story and want to talk about, relationships and chronic illness. So I think it will be great. I think it's going to just give people a voice to be able to talk. So I'm really looking forward to it. I think it will be great. Do we have any other? Let's see here. My blogs are very helpful too. So if you look at my blogs, I talk about sexuality and chronic illness, but shame and chronic illness, depression and chronic illness. I also write for Psychology Today. I publish a blog on there. So, but if you go to my website, it's the same blog. So you'll be able to see both of the different blogs that I write about. Well, thank you. Go ahead, Nancy.
I'm just going to say, how did you get involved with chronic illness?
Well, It's very interesting. I'll share my story just real quick. So I moved to, well, when I was living back in Williamsburg, Virginia, I was a geriatric psychotherapist. And so I saw many folks that were older that were coming in with chronic illness and disabilities. But then I started seeing younger people as well. And I moved to Washington, D.C. to take a job as an administrator at MedStar Washington Hospital Center. And I really missed doing the clinical work. And so I went into private practice part-time. But in 2012, I was actually diagnosed with Lyme's disease. And so being a chronically ill person myself and wanting to really work with others, that was really my drive behind it. But I went to a Building Your Private Practice workshop when I was working at MedStar. And the woman who facilitated the training, who's also one of my mentors now, asked if I wanted to become a sex therapist because there were people who wanted to really reclaim their sexuality due to illness, and sexuality was a big part of their life. And so that started the process. So I took my chronic illness and chronic pain training with my sex therapy training, and I've combined the two. And so it's really been great work so far. There's not many therapists in the DMV area that really focus on this type of niche of chronic illness and sexuality. So I've really enjoyed the work, just helping couples reconnect with each other, but just individuals too. I have a lot of single people that come in that are chronically ill and they want to date and they're scared to date. You know, they want to get out there, but they're afraid. And so just having a place for them to be able to talk about that. So.
You want to put your information back up on the screen so that we can see one more time? And I don't know if anybody has any more questions, hopefully, but we want to be able to keep in touch with you so we can remember all of that great information. And if anybody wants, you can always take a picture of this so you don't have to look them up.
Yeah, so if you want, you can take a screenshot. I've got my website there, and I've got my email. And I think someone asked about, do I do virtual sessions? I do virtual sessions, absolutely. Right now I am full, but I am opening my own practice in a few months. I'm part of a group practice. And because, and this is really a great thing, because my work is getting so busy, I'm getting so many requests to continue to do this work. And the podcast starting, in my book that's in the works, I really need to open my own practice and do this work more. So please stay tuned. If you can hold out until March, I know that's a ways away, but if you stay in contact with me when I open my practice, I will definitely get in touch with you. My contact info is right on the screen. Please write it down so you can keep up with me, keep in touch. And if you send me a message, I'll get back to you as soon as I can. I check my email religiously.
Great, thank you. And somebody also mentioned that it is on the attendees log. So we can find it there too. I think that's great. So Dr. Phillips, let me know. I think if anyone has any more questions, if not, we'll leave it up to you, and hopefully we can say thank you, thank you, thank you.
Oh,
and
you're so welcome. You're so welcome.
And we look forward to being in touch over the year and maybe see you in 6 months if we do a symposium or a summit.
I would love it. I would love it. Please let me know. I'd be more than happy to come back.
Great. Thank you.
Thanks, guys. Thanks to all of you. Take care. And again, my information is right there. So keep in touch. All of you have a great rest of your week, and it's been a pleasure being here.
Thank you. And I think you can close your screen. We can close this, and we're probably good.
All right. Take care, everyone. Bye-bye.
Bye.